Good morning to everyone. I am going to discuss how to diagnose a clinical case. It can be understood in the way that how to solve a multiple choice question or how to solve a clinical case related multiple choice question or how to solve a clinical question in your professional examination, or it may be used just to diagnose a clinical case in any department, whether it is in medicine or pedia or gynae ops or any other. ठीक है, मैं इस स्लाइड में मैं आज के क्लास में ये डिस्कस करने जा रहा हूँ कि हम कैसे एक क्लिनिकल केस को डायग्नोस कर सकते हैं। ये किसी भी संदर्भ में इसको समझा जा सकता है कि कैसे हम किसी मल्टीपल चॉइस क्वेश्चन को सॉल्व कर सकते हैं, क्लिनिकल केस से रिलेटेड क्वेश्चंस को सॉल्व कर सकते हैं, या फिर हम किसी भी पेशेंट की डायग्नोसिस में भी इस आइडिया को यूज़ कर सकते हैं इन एनी डिपार्टमेंट इन योर लाइफ, इन योर क्लिनिकल लाइफ। तो इसके लिए हम लोग समझेंगे कि ये क्लिनिकल क्वेश्चन होता क्या है, व्हाट डज इट्स मीन एक्चुअली। सो इट स्पीक ऑफ इट्स ऑन, मीन्स ये अपने बारे में खुद ही बताता है। अ क्लिनिकल क्वेश्चन, अ मल्टीपल चॉइस क्वेश्चन or any clinical case which you face in your life, it itself expresses that it tells about everything about itself to you, but your blinded brain cannot recognize it. You need to have some idea that how you can diagnose this case, how you can solve this case. Just by listening a clinical case history, you cannot diagnose it. That way you just cannot solve an MCQ by reading the questions and going through the options, because you will misdiagnose it. You are required to have some idea, have some information, have some concept. Then only after that you can diagnose it correctly, you can solve the MCQ correctly. So first point is, it reveals its diagnosis. Means a clinical case is, in most of the cases, the clinical case, the clinical question, the multiple choice question itself show you the picture, itself show you the answer, but you are required to derive it. You are required to harvest it from the very much information provided in the question. In the same way, अगर आपके पास कोई पेशेंट आता है, आप उससे हिस्ट्री लेते हो, उसके साइन एंड सिम्टम्स को सुनते हो, कुछ एग्जामिन करते हो, फिर कुछ टेस्ट भी करवाते हो, और उसके बाद आपको एक आइडिया हो जाता है कि क्या डायग्नोसिस होगा। बट हियर एक प्रैक्टिकल केस में आप इंटरेक्ट कर सकते हो पेशेंट के साथ में, बहुत सारी चीज़ों को एग्ज़ामिन कर सकते हो, बहुत सारी चीज़ों को रूल आउट कर सकते हो बाय साइन एंड सिम्टम्स। और अपना हिस्ट्री लेकर के भी उससे एक प्रोविजनल डायग्नोसिस बना सकते हो और उसको कंफर्म करने के लिए कुछ रिक्वायर्ड इन्वेस्टिगेशन जो है वो करवा सकते हो। लेकिन दिस इज़ नॉट व्हेन यू आर फेसिंग अ क्लिनिकल क्वेश्चन ऑन अ पेपर। जब आप एग्ज़ाम्स में क्लिनिकल क्वेश्चन फेस कर रहे होते हैं, जैसे यूएसएमएलई के क्वेश्चंस हो गए या पीजी एंट्रेंस एग्ज़ाम्स के क्वेश्चन हो गए, और इवन जो नेक्स्ट लेवल 1 या लेवल 2 के एग्ज़ाम्स होने वाले उनके क्वेश्चन हो गए, तो इन दैट केस you are not provided the patient, you are just provided some information about the patient, and from that information you have to derive the diagnosis, you have to derive the answer. So for that you need to be very specific, okay, because the question have been framed with an idea that you have the basic concept, you know the basic information, you have the basic memorable points, you have the basic things in your mind which are required to diagnose a case, which are required to solve a question. Okay, means everything which is required to solve that question has been provided in that question only, and from that information only you have to derive the answer. So the second point is there are some misleaders, means a lot of information will be provided to you, but all the information will not be required for the diagnosis. Few informations are there which are misleaders, which may take you away from the diagnosis, which may create some confusion in your mind, and you have to identify those misleaders. Only after that you will be able to diagnose it. Now you have to correlate all points, as misleader is also there and the required informations are also there. So it is very necessary for you to identify which informations are taking you toward the diagnosis and which information is taking you away from the diagnosis. Then only you can come to a clue, you can come to a diagnosis. If you will think or you will try to correlate every point, every information with a diagnosis, then you will be misled. You will have a more than one answer correct, means more than one option will appear correct to you if you will correlate every information provided in the question with the diagnosis. So few informations are there which are not related directly with the diagnosis. So to those information you have to exclude. You have to exclude few options also. It means by examining the information provided there, you have to exclude few options, that this option is not related directly to the more than one information provided. You must remember the pathognomonics. Look, in some question, a lot of information is provided with few pathognomonic signs. It may appear that if you don't know the pathognomonic sign, then you may miss the question. That is, a अगर पैथोग्नोमोनिक साइन से अवेयर नहीं है तो क्वेश्चन में दिए गए सारे इन्फॉर्मेशंस आपको किसी अलग डायग्नोस्टिक्स के तरफ ले जा सकते हैं। लेकिन अगर आपको पता है कि ये पैथोग्नोमोनिक साइन किस डिज़ीज़ का पैथोग्नोमोनिक है, मीन्स किस डिज़ीज़ को ये डायरेक्टली इंडिकेट करता है, तभी आप उसको एग्जैक्टली डायग्नोस कर पाएंगे। बहुत बार पैथोग्नोमोनिक साइन को दिया जाता है ऐसे क्वेश्चंस में जहाँ पर बहुत ज़्यादा इन्फॉर्मेशन अवेलेबल नहीं है, ताकि आप पैथोग्नोमोनिक साइन के बदौलत अपने डायग्नोसिस को कर सकें और सही ऑप्शन को चूज़ कर सकें। सो व्हेन अ क्वेश्चन इज़ फ्रेम्ड, it is framed with an idea to test your memory, to test your concept, to test your analysis skill, that how you can analyze a case when you have been provided with several information related to the patient's symptoms, sign, laboratory finding, radiological finding. Then at finally, how can you correlate all these information? So very few questions are framed with an idea to test your memory just. But maximum clinical question in an examination point of view are provided with an idea to test your overall development, that how much skill you have acquired till now in your medical education to diagnose a disease. So you must have some basic concept about the subject, about every clinical subject, about the basic subject which you read in your first and second MBBS year. You must have some basic parameters knowledge, that how the biochemical parameters are correlated with the disease. You must have some basic idea of the radiological knowledge, radiological feature which are pathognomonic of some diseases. You must have some basic knowledge about the pathological microscopic features, microscopic finding, and also the blood picture. So for solving a question, you will be required to have information related to your basic sciences, your preclinical subject, your paraclinical subject, and obviously your clinical subject. Then only you will be able to solve a clinical case or an multiple choice question correctly. Okay. Now coming over to the part of a clinical case. A clinical case or a multiple choice question related to clinical case have several parts. For example, age, sex, age and sex in combination, clinical symptoms and sign, laboratory finding, radiological finding, and drug, which may be a single drug or in a combination. लेकिन ये जितने भी इंफॉर्मेशन प्रोवाइड किए जाते हैं, इन सब इंफॉर्मेशन का कुछ मतलब होता है. Many of these are provided to support you, and a few information are provided to confuse you, to check your analytical skill. For example, अगर आपको क्वेश्चन में एज दिया गया है तो उस एज का कोई ना कोई कोरिलेशन हो सकता है डिजीज़ के साथ में. जैसे कि अगर पेशेंट जो है वो चाइल्डहुड एज का है तो ज़्यादा चांसेस है कि जो डिजीज़ के बारे में क्वेश्चन दिया गया है, दैट डिजीज इज मोस्ट कॉमनली प्रिवेलेंट इन द चाइल्डहुड स्टेज। अगर ये एज एक न्यूबॉर्न का है तो मोस्ट प्रोबेबली ये किसी कॉन्जेनाइटल डिजीज़ के बारे में हो सकता है, किसी मेल फॉर्म डिजीज़ के बारे में हो सकता है। अगर ये एज ग्रुप इन्फेंटहुड का है, अंडर 6 मंथ का है, तो इट मे बी अ केस ऑफ इनबॉर्न एरर ऑफ मेटाबॉलिज्म। अगर ये एज एडल्टहुड का है, then it may be related to those diseases which are common in adult age. अगर ये एज रिप्रोडक्टिव एज ग्रुप का है, then it may be a disease which is too much common in reproductive age group, may be related to the occupation, may be related to the occupation of the person in that age group. अगर ये साइकेट्रिक का क्वेश्चन है और एज ग्रुप दिया गया है, तो ये इंडिकेट कर रहा है कि उस एज ग्रुप के लोग किस साइकोलॉजिकल बिहेवियर से ज़्यादातर सफ़र करते हैं, किस साइकोलॉजिकल साइकोटिक डिजीज़ से ज़्यादातर सफ़र करते हैं, या एज रिलेटेड कौन सा न्यूरोसिस जो है वो उस एज में कॉमन है। तो एज का जो इम्पोर्टेंस है वो हर तरह के सब्जेक्ट में है, वेदर इट इज़ अ मेडिकल केस और अ सर्जिकल केस और एन साइकोलॉजिकल केस और एन केस related to orthopedic. In that also the sex. What is the importance of sex? Actually, few diseases occur only in male or only in female, or they occur most commonly in male or in female. जैसे कि अगर कोई congenital disease है which is heredited through X-linked recessive trait, then it will occur only in male child. It may be manifested either in the first year of age, either in the childhood, or it may be manifested in the middle ages, like Duchenne muscular dystrophy. सो सेक्स का यहाँ पर आप इसको इस तरह से कोरिलेट कर सकते हैं कि अगर सेक्स डिफ़ाइन किया गया है क्वेश्चन में, तो इसका कुछ न कुछ इम्पोर्टेंस है। अगर एज एंड सेक्स साथ में दिया गया है, मीन्स एज भी दिया गया है, सेक्स भी दिया गया है, तो ये इंडिकेट कर रहा है, फॉर एग्ज़ाम्पल अ फीमेल ऑफ 40 ईयर एज। तो अगर ये क्वेश्चन में है अ फीमेल ऑफ 40 ईयर एज, देन यू हैव टू थिंक अबाउट दोज क्लिनिकल कंडीशन विच आर कॉमन इन दैट एज ग्रुप। इट मे बी रिलेटेड टू द हार्मोनल contraceptive methods, it may be related to gallbladder stone, it may be related to other diseases. For example, if a female of age group 60 has been mentioned in the question, then it is suggesting you that the female has crossed the menopause age. Then what the diseases are common in that age group? So you have to think about it. If there is any suggestion in the question of certain age and certain sex, then it is directing you toward the diagnosis of some certain disease. It means it is helping you in the diagnosis. it is not confusing you. So in the question कुछ बिहेवियरल पैटर्न भी दिए जा सकते हैं, जैसे एन एल्कोहलिक पेशेंट. तो एल्कोहलिक पेशेंट अगर ये मेंशन किया गया है क्वेश्चन में, इट मीन्स द डिजीज इज समहाउ और द अदर इज रिलेटेड विद द कंजम्पशन ऑफ एल्कोहल. वो एल्कोहलिक लिवर डिजीज़ की तरफ सजेस्ट कर सकता है, वो हाइपर यूरिसेमिया इंक्रीज यूरिक एसिड लेवल के तरफ सजेस्ट कर सकता है. ऐसे ही अगर क्वेश्चन में occupational history has been mentioned, then again it must have some importance. You have to correlate that how this occupation is related with the sign and symptom, or either it may be directly related or it may be indirectly related. Okay, for example, if there is in the question अगर ऐसा है कि a politician of 45 year of age is suffering from or having a complaint of hyperacidity and stomach pain or duodenal pain, a pain in the epigastric region, which get initiated after consumption of meal, then his symptom itself is suggesting toward ulcer. Now, what is the importance of age? What is the importance of occupation in this case? The importance of occupation is that that politician is supposed to get exposed to his political tension, and you know that occupational tension are too much related to the gastric ulcer and peptic ulcer in that age group. So an occupational history may be given in the question which may be correlated directly or indirectly. So this is correlated indirectly, but what if you get mention that if you get some point that a person working in coal field or coal mines or working in some other mine or a person working in a leather industry, then these occupation are related directly with the disease. जैसे कि जो लेदर इंडस्ट्री में काम करते हैं और अपने कंधों पर जानवरों को, मरे हुए जानवरों को ढोते हैं, तो वैसे लोग किस डिजीज़ के लिए एक्सपोज रहते हैं? They are exposed to the microbial infection related to that organism. It may be suggested in the other line of the question. अगर कोई माइंस में occupational history दे रहा है, then that person is then you have to correlate his symptoms, whether he is having some symptom of pneumoconiosis or other interstitial lung diseases, bagasosis or other disease related to lung. So occupational history का भी अपना importance है, and if it has been mentioned in the question, then it must have some importance in the diagnosis of the question. Now clinical symptom and sign. Clinical symptom and sign का क्या importance है? Clinical symptom और sign, clinical symptoms वो होता है जो पेशेंट हमें बताते हैं, कंप्लेन करते हैं, और साइन वो होता है जो एक फिजिशियन एलिसिट करता है पेशेंट के ऊपर. नाउ योर साइन मे बी related with the symptom or it may not be related with the symptom, or the patient may be able to express his symptom completely, or he may be hiding few symptoms which he himself is thinking that is not essential for his diagnosis. लेकिन जब हमें क्वेश्चन मिलता है ऑन द पेपर, तो उसमें सिम्टम्स जो भी दिए होते हैं वो हमें डायग्नोसिस की तरफ हेल्प करने के लिए ही दिए होते हैं, और उससे रिलेटेड जो उसमें साइन होता है दैट इज़ ऑल्सो प्रोवाइडेड टू हेल्प यू इन द डायग्नोसिस। कुछ सिम्टम्स ऐसे हो सकते हैं जो जनरल सिम्टम्स हों, मीन्स फॉर एग्ज़ाम्पल फीवर, बॉडी एक, मलेज। मीन्स अगर फीवर दिया हुआ है तो ये फीवर बिल्कुल भी जनरल सिम्टम हो गया, ये तुम्हें किसी खास डायग्नोसिस की तरफ इंडिकेट नहीं करेगा। लेकिन अगर साथ में बॉडी एक एंड मलेज दिया हुआ है, फीलिंग ऑफ illness, then they are suggesting that the patient may be suffering from a viral infection. जो सिम्टम हमें प्रोवाइड किए जाते हैं क्वेश्चन में वो जनरल सिम्टम्स भी हो सकते हैं और वो स्पेसिफिक सिम्टम्स भी हो सकते हैं। अगर जनरल सिम्टम्स हैं तो डोंट रन फॉर द डायग्नोसिस टू फास्ट, देन यू हैव टू स्टे, जस्ट गिव अ पॉज and see about the other information provided in the question. See whether those general symptoms correlate with the sign or not. That general symptoms may be provided for misleading you. So you have to see, you have to consider the other factors. You have to consider the laboratory finding, the radiological finding. Now the other part of the question is now you have received the information about the age, about the sex, about the occupation, about the behavior, and then about the symptom and sign. After that, what the next information you are required? You are required the laboratory finding. It may be biochemical finding, it may be pathological finding, or it may be microbiological finding. So these laboratory findings are provided. Again, it may be, or they may be a general laboratory finding, or they may be a specific laboratory finding indicating toward the specific diagnosis. So again you are required to have the skill to analyze whether those laboratory findings which has been mentioned in the question are directly related with the diagnosis or they are just a general finding. When laboratory findings, when more than one or two laboratory findings are given, then among those few are general finding and not very specific, and few laboratory findings are specific and diagnostic. So you have to analyze that which laboratory finding is maximally correlated with the clinical symptom, sign, with the age and sex, and with the diagnostic clue provided in the question. I will illustrate these things later on while discussing the questions of the clinical cases. Now radiological finding. Radiological findings are provided. Think for a while, when do you go for a radiological imaging of a patient while in your clinical practice? A physician very rarely go for a radiological investigation when he think of some anatomical involvement of some part, then only he go for X-ray or ultrasonography or CT or MRI. Means most of the time a clinician go for a radiological finding for confirming his provisional diagnosis. Means before going to the radiological finding, you must be able to have some provisional diagnosis of the question, and radiological findings information is utilized for the confirmation of your provisional diagnosis. Means by getting the information about all the points which I have discussed till now, you must have few provisional diagnoses in your brain, and then you can only utilize the radiological information given in the question for confirmation. And many times X-ray finding are given in the clinical questions, which suggest you that how his or her symptoms are related. Not all the time your radiological finding will match with the laboratory finding. So don't get confused. Try to match the radiological finding with the clinical symptom provided in the question. Not necessarily all the laboratory finding, all the pathological or biochemical finding will match with the radiological finding. But those biochemical finding which will support your radiological finding to diagnose a case, to diagnose or to confirm a case, gives you a clue about the diagnosis. So by seeing all this information, you can diagnose a case. But in every clinical question, in every multiple choice question, you will not be provided with all this information. But information may be few or may be all. But with the only information which has been provided, it is presumed that those information are enough to diagnose a case in an examination setting. Okay. Now there may be a history of few drugs, a single drug or drug in combination. Now what is the importance of mentioning a drug in the example, means in the question? So when a single drug is given, mentioned in the question, then the clinical case may be related with the side effect of the drug, with the adverse effect of the drug, with the very rare adverse effect of the drug. अगर क्वेश्चन में ड्रग के बारे में मेंशन किया गया है तो वो आपको ये नहीं सजेस्ट कर रहा है, वो आपको ये नहीं बता रहा है कि इसका डायग्नोसिस क्या था और इसमें वो ये ड्रग हम चला रहे हैं. नहीं, मोस्ट ऑफ द टाइम अगर ड्रग को मेंशन किया जाता है क्वेश्चन में तो वो हमें बताया जाता है कि इस ड्रग को लेने के बाद में कुछ सिम्टम आए तो वो सिम्टम्स उस ड्रग के साइड इफ़ेक्ट हो सकते हैं, उसका एडवर्स ड्रग रिएक्शन हो सकता है, रेयरेस्ट रिएक्शन भी हो सकता है. और अगर एक से ज़्यादा, व्हेन मोर देन वन ड्रग or in drug in combination has been mentioned in the question, then it is suggesting you toward their interaction. Okay, that one drug may be enzyme inhibitor, it may be the enzyme inducer of the cytochrome P450 enzyme, and the other drug may be acted upon by the cytochrome P450, or these two drugs may be correlated in somehow way or the other. अगर कोई ड्रग मेंशन किया गया है क्वेश्चन में तो वो टेराटोजेनिक हो सकता है, इस कारण से भी मेंशन किया गया हो, यह वो किसी खास तरह के इफ़ेक्ट को बढ़ाने वाला हो सकता है. इट मे बी stimulant of it may be muscle relaxant, it may be muscle stimulant, it may be anticoagulant, it may interfere with the coagulation, it may interfere with the absorption of vitamins, minerals, or it may interfere with some physiological process. It may be responsible for damaging certain function of the liver or any other. So अगर ड्रग मेंशन किया गया है क्वेश्चन में, तो that should not be neglected, because it must have some clinical importance required for the diagnosis of that particular question. So that's all for today's discussion. In the next part of the video, or in the next video, I will take some example of the clinical cases, and I will try to illustrate all these points which I have mentioned just now. Okay, thank you to all of you for watching my video. I will keep on posting videos which will help you in both in your clinical practices and in facing your exams. So if you really like my video, then give your comment, give your like, share this video to motivate me much, so that I can prepare more video for you. Okay, thank you.